Your cholesterol is perfect, your blood pressure is fine, you eat clean, you work out, you do everything right. But then one day, heart attack. This has happened to several of my patients, and I have always wondered why, since they all had healthy lifestyles and doing all the right things, was there something that I was missing as a doctor? A risk factor that 80% of Americans have never even heard of, and your doctor has probably never checked. It's called LP little a, and it might be hiding in your blood right now. I'm Dr. Sievers, NeighborhoodDocB, board certified family medicine doc and community doc. And today I'm going to tell you exactly what LP little a is, why it matters, who's at risk, and what you actually need to do about it. Stay with me because this might literally save your life or someone you love. What is LP little a? You've heard of LDL, which is the bad cholesterol. LP little a is kind of like LDL's dangerous cousin. You know that one cousin you call, same family, but meaner. But here's a wild part, your body makes it. It's not from your diet, it's not from stress, it's mostly genetic. You were either born with it or you weren't. And it stays at that level for life. Think about that for a second. No matter how good you eat, how much you exercise, or how many supplements you take, if LP little a is high, it's high. Full stop. Now, 1 in 5 people globally have elevated LP little a. That's roughly 1.4 billion people. That's not a rare condition. That's a massive silent epidemic most people have never heard of. It's crazy how something this common almost gets zero airtime. But here's what makes it even scarier. It doesn't just clog your arteries, it does something worse. And I'll explain that in a second. Okay, follow me on this one. Most people think that heart disease is simple. Cholesterol builds up, clogs your pipes, bad things happen. But LP little a, it attacks in three different ways at the same time. Number one, it acts like LDL. It gets into your artery walls and builds up plaque, classic heart disease stuff. Number two, it's an arsonist. It carries these toxic molecules called oxidized phospholipids that trigger inflammation. It's like a slow burn going on inside your arteries 24/7. Number three, and this one's wild, it can block your body's natural ability to dissolve blood clots. So when the plaque ruptures, instead of your body cleaning it up, LP little a gets in the way. That's how you get a heart attack. Oh, and it doesn't stop at heart attacks. High LP little a is strongly linked with aortic stenosis. That's when the valves in your heart get calcified and stop working properly. That can also kill you too. It's wild how one particle can cause this much damage. Now, let's talk about risks, because this is where it gets real for a lot of us. You might be thinking, okay, doc, my cholesterol is fine, I'm good. But here's the thing, LP little a is completely independent of LDL. You might have perfect cholesterol and still be at serious risk. Keep watching. Here's where I need you to pay close attention, especially if you're Black, South Asian, or come from communities like mine. Studies consistently show that people of African or South Asian ancestry tend to have higher LPA levels than other groups. That's not a scare tactic, that's data. And in communities dealing with less access to healthcare, this matters even more. I grew up in Long Beach. I know what it's like where people don't get the preventative care they need. This is why I'm talking about it right now, because your zip code shouldn't determine whether you know about a risk factor that affects your heart. And here's what the numbers actually look like. If your LP little a is above 50 milligrams per deciliter, it affects about 20% of the population. Your risk for a heart attack is already 40% higher than average. Get above 100, double the risk. At 180 milligrams per deciliter, you're looking at 4 times the risk. The same risk as someone with Miller hypercholesterolemia, one of the most dangerous inherited cholesterol conditions out there. 4 times, let that land. Now, the most important question, should you get tested? And what do you even do if your numbers come back high? I got you. That's what's next. All right, here's a part that actually matters, what you can do. First, get tested. It's a simple blood test that you can order online, or you can have and see if your healthcare institute actually orders it. And you also don't even have to be fasting. And as of 2026, the American College of Cardiology and American Heart Association now recommends that all adults get their LP little a checked at least once in their lifetime. Class 1, that's the highest recommendation they gave. One test, that's it. Because your LP little a is stable, it doesn't change much throughout your life. So you check it once, know your numbers, and you plan accordingly. Now, this is where I have to get real with you. If your numbers come back high, the current options are limited. Statins, the most common cholesterol medication, don't lower LP little way. There are some evidence that actually suggests it slightly raises it. That doesn't mean you stop taking them if your doctor prescribes them. They still protect you in other ways. There are medications called PCSK9 inhibitors that can lower LP little way by 15 to 30%, and they're already being used for high risk patients. For extreme cases, there's a process called lipoprotein apheresis. Think of it like dialysis for your blood. But here's the exciting part. Trust me on this one. There are brand new therapies in clinical trials that can lower or drop LP little y by 80 to 90%. We're talking about potentially completely eliminating this risk factor. The science is moving fast. I mean, real fast. So know your numbers matters now, even if treatment options are still evolving, because it helps your doctors manage everything else more aggressively. And if you have a parent, sibling, anyone in your family with early heart disease, please hear me on this one. This might be the thing they're missing. Keep watching. I'm going to explain exactly where you tell your doctor. Because LP little way is genetic, it runs in families. If you find out your number's high, it's a sign to get your family checked as well. Parents, siblings, your adult kids. Doctors call this cascade testing. It's how we catch people before something happens to them. Think about it. If you have a family history of early heart disease, strokes, or heart valve disease, LP little a might be the thread connecting all of that nobody's ever checked. In communities like the ones I grew up in, you often find out about these things too late. But you're watching this right now. That's a head start. So this is what I want you to do. Next time you see a doctor, or this week if you can, ask about LP little way. It's worth a shot. If not, then I would definitely consider purchasing it out of pocket. All right, let's bring it home. LP little way is a genetically inherited particle that silently raises your risk of heart attacks, strokes, and heart valve disease. And 1 in 5 people have elevated levels that they don't even know about it. It's independent of your regular cholesterol. It doesn't respond to diet or exercise, and your doctor may have never checked it. The good news is, one simple test can tell you everything, and new treatments are coming that can change the game completely. Know your numbers, talk to your doctor. I'm Dr. Sievers, Neighborhood Doc B, Community Doc, doing what community docs do. If this helped you, share this with someone you love because that share might literally save a life.